Good afternoon. I'm Tom Hudako from the Utah Department of Health. Welcome to today's daily COVID-19 media briefing. We will hear from one speaker today. That will be Dr. Angela Dunn, the state epidemiologist from the Department of Health, who will be providing a situation update. Dr. Dunn?
Okay, good afternoon. We now have 3,296 identified COVID-19 cases here in Utah. That is an increase of just 83 from yesterday, or a 3% increase in the growth rate. We've tested 72,358 Utahns for COVID, an increase of 4,047 from yesterday. And we have slightly decreased our positive rate to 4.5%. We have 277 total hospitalizations for this outbreak, an increase of 9 hospitalizations from yesterday. And we do have an additional 4 deaths to report today. We have total 32 COVID-related deaths since the beginning of this outbreak. The 4 additional deaths were all over the age of 60, were hospitalized at their time of death, and had underlying medical conditions. 2 of them were residents of a long-term care facility associated outbreak. 3 were residents of Salt Lake County and 1 of Weber County. So I want to note that half of our total deaths, 16 out of 32, have been among individuals infected with COVID-19 at a long-term care facility. And this number, while tragic, it could be a lot higher, as we have seen in other states where a single long-term care facility outbreak has resulted in more deaths than this. Our Utah long-term care facility staff have been preparing since early January to quickly identify any COVID-19 cases and limit the spread in their residences. And they are doing a great job. And I really want to recognize the long-term care facility staff out there whose job is more stressful now than ever, and yet so important to protecting this very vulnerable population. They're protecting not only the health of their residents, but also their mental health well-being, as families aren't allowed to visit. So thank you to all of the long-term care facility staff out there who are essential in this response. With that, I'll take questions.
Hey, Dr. Dunn. I had kind of a unique experience. On Saturday, I had a number of symptoms, and I went to get tested, and thankfully I'm negative. But I had a woman reach out to me on Facebook, and she was having symptoms, and she seemed even now like hesitant to get tested. I think that we hear you every day, and you say if you have these symptoms, get tested. We have the capacity, but for folks out there who may still be afraid to get tested, or given my experience, do you have any just general comments about kind of testing in our state and what you'd like to encourage?
Sure. So again, we have the luxury in this state to be able to test anybody with the most mild of symptoms related to COVID-19. So we've articulated those 6 symptoms before: fever, cough, shortness of breath, muscle aches and pains, sore throat, or a decreased sense of taste or smell. And we really need people who have the most mild of symptoms to get tested, so that we as public health can have really good data to identify the burden of spread across our state that will be informing policy and public health interventions. It is important to know that testing is free through the CARES Act, so nobody should be charged for testing or care related to COVID-19, and that we do have testing sites available throughout the state. So people can go to coronavirus.utah.gov and look up our testing locations to find a place that's convenient for them to go.
Hi, Dr. Dunn. First of all, we on the media Zoom call, we didn't have sound for the first little bit here, so I was wondering if you could just say the details about the new deaths again.
Sure.
And then secondly, I wanted to ask about homeless facilities. Last week, there was a large outbreak at a Salt Lake County facility. So I was wondering if you're aware of any other outbreaks like that, and then what the state's doing to mitigate those.
Sure. So for the deaths, we have 32 total COVID-related deaths in Utah. That's an increase of 4 from yesterday. All were over the age of 60, hospitalized at the time of death with underlying medical conditions, and 2 were associated with a long-term care facility that was having an outbreak. 3 of the deaths were Salt Lake County residents and 1 Weber County. With regards to the homeless outbreak, that outbreak in Salt Lake County is the only one we are aware of right now. And we have worked to ensure that everybody who has possibly been exposed has been tested. And Salt Lake County has worked very closely with the homeless resource centers to adequately separate those who were exposed, those who have COVID, from those who are unexposed or who don't have COVID. So they're doing a great job in terms of limiting spread among that population. And it's something that we're going to continue focusing on throughout this outbreak with that particularly vulnerable population.
Hi, it's Ashley Imlay with the Deseret News. I am wondering if you know how many healthcare workers have tested positive for the virus, and we haven't heard reports of any deaths. And so I just want to make sure that there are still no deaths among that group.
Sure. So I don't have the specific numbers on me right now of how many healthcare workers have been infected, but it is a handful. The vast majority of our cases are not healthcare workers, and we have not had any deaths among healthcare workers infected with COVID-19 here in Utah.
Hi, yes, David Boyle with KPCW Radio. Here in the Wasatch Back, numbers went up by 13 from Sunday to Monday in Summit County. And you talked about yesterday about those mobile testing sites, and we have one of those,
Yep.
kind of a mobile site going throughout the county. How did you identify Summit County as a hotspot? How was it decided that it would get a mobile testing center? And then are we going to see an increase in cases as we increase testing there?
Absolutely. So first, the Utah Department of Health is working closely with our partners to increase the number of mobile testing sites or units we have in order to go to hotspots and go to these outbreak situations to be able to test everybody who is potentially exposed. So you're right, that's going to drive up our positive number because we're really doing targeted testing among those people who are most likely to have COVID-19 with those mobile testing units. Summit County has been a hotspot since the beginning of this outbreak. They were really the first health district to have a big cluster of cases around a specific exposure site, and that has continued throughout the outbreak. They have done a great job in terms of limiting the spread within Summit County. So their social distancing restrictions are working and have worked to decrease the spread within that county. Over the weekend, Summit County worked with the Utah Public Health Laboratory and Intermountain to actually proactively go out to specific hotspot sites throughout Summit County and do testing of both symptomatic and asymptomatic people. So that's likely the reason why we did see those 13 cases identified in Summit County, because there were specific targeted efforts going on over the weekend.
Hi, thanks for taking the question. To follow up on the nursing home issue, has there been widespread testing at nursing homes? And do you know of our total deaths, how many of those have been at nursing homes?
Yeah, so we've had a total of 32 deaths. 16 of those have been related to a long-term care facility. We currently go into long-term care facilities when there is a known case, and we test all residents and staff for COVID-19 in order to ensure appropriate cohorting of both staff and patients. There are plans in place to do more proactive testing of long-term care facilities where there isn't a known case, and we're working through that process now.
Hi, Dr. Dunn, Nick from ABC4. Just anecdotally, there are some folks who just don't seem worried about this at all. I mean, they almost want to shake your hand, stand next to you. They seem to think that, yeah, it's out there, but the economy just needs to get back open. We just need to start working again. Obviously, this is complicated, but do you have any general comments about folks who definitely share that sentiment? Even older folks, and I don't mean elderly, but it's a fascinating time, and certain people just tend to think that it's not that big of a deal.
Yeah, I mean, we are asking the public to do a lot in terms of staying home, not seeing extended family members, not going to work, limiting their outdoor excursions to grocery stores or other things. So I can understand how it's been a burden on the public. However, now more than ever, it's really important for the public to adhere to those social distancing recommendations. We are seeing really positive things in our numbers that are a sign that we're flattening the curve. And so that means it's even more important for us to continue doing this until we start seeing a decrease. so that when we can open up the economy, we don't see a surge in cases again. So even though it might feel safe right now, it feels safe because we have been adhering to social distancing restrictions, and we really just need to stay the course so that we can keep this trend going and see a downward trend.
I just had one quick follow-up on the nursing home question. Has the testing that has been done, has that kind of avoided perhaps a wider outbreak? Has that been something that's been able to stop that in its tracks a little bit?
Yeah, absolutely. So our Utah Public Health Laboratory has a mobile unit that is able to go directly to the long-term care facilities when we identify a case and immediately test all staff and residents. And that allows the long-term care facility to quickly separate the at-risk for COVID-19 or the positives from the negatives, are people who weren't exposed, and that is key to stopping the spread within those facilities. So the first step is the facility doing a really great job at quickly identifying anyone with symptoms consistent with COVID, and then the Utah Public Health Laboratory and our healthcare association's infection team going out there and doing the testing. We're good? Okay, you guys have a great afternoon. Thank you.